We're back here on the Lynn Hayes Freeland Show. You would be amazed at what happens in the commercial breaks. All right, it's January 25th.
Yes.
This all kicks off. Do I need to register? Tell me all the logistical stuff first.
Actually, this time registration is not required. You are required to just show up.
Okay.
We decided, as Geraldine said, to try to just minimize and keep the barriers down. There's no fee, and you don't have to register. It would be good if you would send us an email, which is on the flyer, or call, because we are providing a meal. So we would like to have some idea, but it is definitely not a requirement.
Okay, all right. I mean, you say a meal, light breakfast, lunch, giveaways. Yeah, you need some kind of idea who's coming.
Yeah, we need some
You need some kind of count? Okay. All right.
We just want people to be motivated to see what this conversation is going to be about. And that's why we've included the organizations who are involved, the Center for Life.
Okay, and a couple other groups we're going to meet in just a few minutes. Okay.
The reason being because they serve the people in Hazelwood, these organizations.
Now, how'd you end up in Hazelwood?
Oh.
Not a trick question.
Because, as I said, I knew it was time to repurpose, and I knew it was time to get a change of venue in terms of the places I've always been before, attracting that audience, and coming to a place like Hazelwood that is right now on the verge or on the cusp of becoming brand new itself, along with the fact that for many years Hazelwood was plagued by the elements of the steel mills.
Okay. All right.
And sometimes there was a criminal element that's all kind of calmed down now, and they had a kind of a conversation about them that wasn't necessarily always savory, but it's an awesome place. And people need to have this information to empower them and impact them to be proactive about their health.
Dr. Evans, what are two things that people will walk away with that they didn't know before after the 25th?
That if you're uninsured or underinsured, you'll have a number and a contact and a process to be able to be served, and for breast and cervical cancer education and prevention, for screening, because we know screening saves lives. And our women and men with breast cancer will come away being empowered with the fact that they have the power to change their outcome and how their individual stories end by just participating and showing up.
Did Matthew Knowles coming forward help African American men understand that they need to be aggressive about testing and paying attention for breast cancer?
Absolutely. Whenever there is celebrity involved and who is willing to share their stories, it has always helped raise the level of awareness even in our specific communities for cancer care and prevention and treatment.
And Geraldine, when Dr. Evans talks about cancer, and he talks about breast cancer affects men, and we're talking about the physical effects, and you mentioned kids. The realities are, if a cancer affects mom, dad, grandma, auntie, it affects the whole family.
It affects the whole family, and it takes away from the family. The family resources get tapped out. The family's emotional stuff gets taken away. Mental health issues rise to the top at times when there are these kind of illnesses. And so one of the reasons that the Center of Life got involved is because as the family strengthening coordinator, my sister died of breast cancer at 32. My other sister died from aggressive lung cancer at 49, and my husband died at 41 from colon cancer. So when Renee came to me, it was a no-brainer for me.
Yeah.
It was a no-brainer, and I, as a mental health care specialist, wanted that part in there too, because I see too many of us that are not getting their mental health taken care of because they're afraid of the diagnosis or the stigmatism of being talked about because they went to see a mental health specialist. Meanwhile, so that it's just a holistic approach that has brought this to me. That I raised my kids in Hazelwood, and so it's so important to me to know that the people in Hazelwood are going to be taken care of, or at least get the information that's in the other part of the city. That we've done this elsewhere. Homewood's doing it, a
Sure.
dinner and a dialogue. And so when Renee came to me, I was like, yes,
You're
Renee.
like, why not Hazelwood?
Yes, yes.
Right.
Why not my hood?
That's right.
Why not my
That's
hood?
right.
There you
That's
go.
right. That's right.
Exactly.
And just as Geraldine said, what's important is for her to continue to share that story, because just in that clip, she shared the top 3 cancers that are mostly impacting our community: lung cancer, breast cancer, and colon cancer. So we have to come out and hear the other stories.
Indeed.
And with that said, if I may, there's going to be a
quick.
panel conversation of survivors of those cancers, plus mental health, plus heart disease.
Okay, and that's it. That's the thing. You got to hear that other people
gotta hear
went
that
through it and came out on the other
Right,
side.
right,
And there's
right.
new numbers about lung cancer that actually, correct? Aren't there the survival rate? Okay, all right, we got to go commercial break. I'll talk about that on the other side. We'll be right back. Aren't there new numbers about